On the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, welcome into the program. I'm Dave Wilson. It is colon cancer Awareness Month, and that is going to be the main topic of discussion this morning. Our guests today are Dr. Mark Johnson, General Surgeon, Mon Health Surgical Care. Good morning, Dr. Johnson.
Good morning. Good morning. How are you?
I'm doing well. And we have Ray Adams, physical therapist and cancer rehabilitation specialist. Good morning, Ray.
Hey, good morning. Thanks for having me.
Hey, guys, thanks for taking a few minutes. We'll get into the discussion about colon cancer and Colon Cancer Awareness Month in just a moment, but want to get to know you guys just a little bit better. So we'll start with you, Dr. Johnson. Talk about your background. Where'd you come from, your education, how you ended up with Mon Health?
Dave, I'm a Morgantown native, born and raised, went to school here, went to the basketball powerhouse in the state of West Virginia, Morgantown High School. And then I went away and did all my training outside of Morgantown, but came back to join my dad in his practice 24 years ago, and I've been working with the Mon Health system ever since then.
You're a general surgeon, so what all does that entail?
Well, that's one of the great things about being a general surgeon in Morgantown is it's really a broad practice. So the majority of my work is abdominal, from colon surgery, for example, gallbladders, hernias, and things of that nature. But I also do some thyroid surgery, and I do a little bit of vascular surgery, and I certainly do a lot of wound care and things of that nature. So every day is a little different.
Also joining us today is Ray Adams, physical therapist, cancer rehabilitation specialist, as I mentioned. Ray, same question to you. Tell us about your background, education, how you ended up with Mon Health.
Yeah, I moved to Pocahontas County, West Virginia when I was 10 years old with my family. I did my undergraduate work at Marshall University in Huntington, did some graduate work at the University of Pittsburgh in Pittsburgh, and in 97 I moved to Morgantown to go to physical therapy school at WVU. And for the past 22 years, I've been an orthopedic specialist. And about a year ago, I moved into the cancer world. It appeared to be an area of kind of growing need, and I wanted to be part of that experience.
And Ray, explain cancer rehabilitation specialist. What does that job entail?
Well, what we've done is I've undergone special training in the different realms of cancer, and probably more specifically how to deal with the side effects and the treatments that are involved with treating cancer, from the surgical techniques, trying to understand what they are, to the medications and also the radiation and the side effects and things that can come from those types of treatments.
All right. As I mentioned, it is Colon Cancer Awareness Month. And Dr. Johnson, what are some of the symptoms one might notice with colon cancer?
Well, to be honest with you, one of the frustrations about managing colon cancer is that in the very beginning, the symptoms are non-existent. Which is why there is such an important focus on screening. Typical symptoms of colon cancer, though, would include things like irregular bowel habits, a change from your normal. It's including a change in the consistency, the color, or the frequency. Sometimes abdominal pain, weight loss, just feeling kind of crummy. All of those, anemia. Some of my patients come to me because their family doctors identify anemia, and they send them to me for evaluation. Again, though, I think the real critical point is that for a lot of people, there are no initial symptoms, and that's why vigilance on their part and the importance of screening examinations is critical.
Yeah, my next question was, can it be caught early? And I kind of got a feeling the answer is yes, if. And I guess you can finish that statement.
Yeah, absolutely. So I think, one of the greatest advantages in terms of cancer management overall, but particularly with our topic this morning, colon cancer, is the recognition that the earlier we find the problem, the much better chances that we have of solving the problem. So the days of sort of hiding your head in the sand so that you don't have to deal with that really ought to be gone. So surveillance examinations, and there are several techniques that we use to help people to screen for colon cancer, but they really make a huge difference. And certainly my job and frankly Ray's job is a lot easier if we can find colon cancer in its earliest stages, or even before it becomes a cancer, for example, in the form of a polyp.
Do you want to dispel any myths about colonoscopies while we have a moment here?
Well, listen, I always, I tend to have, I'm a glass half full kind of guy. And so, I always look at my patients and say, listen, you are really doing something good for yourself. You're taking advantage of a great opportunity to make sure that you don't have a problem. And then I tease them all and I tell them, listen, today I can guarantee you that you're not full of it. So if anybody questions me, I can testify on your behalf, at least for that day. And so I tend to, it should be rather than the thought of an unpleasant experience. And to be honest with you, most of my patients will tell you that experience itself is actually quite refreshing. We use a little bit of anesthesia, so you get a nice nap. You wake up, you're good to go for the day, and you can go off and celebrate the fact that you did good for yourself.
Our guests this morning are Dr. Mark Johnson, General Surgeon, Mon Health Surgical Care, and Ray Adams, Physical Therapist and Cancer Rehabilitation Specialist. March is Colon Cancer Awareness Month, and we'll continue our conversation in a moment. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Talking to Dr. Mark Johnson, General Surgeon, Mon Health Surgical Care, and Ray Adams, Physical Therapist and Cancer Rehabilitation Specialist. If you do detect, Dr. Johnson, a colon cancer, how is that treated? What kind of procedure are you looking at?
Well, there's a complicated answer to that question, but typically most patients that have colon cancer start with a surgical procedure, and that would be a colectomy, which is removal of a portion of the colon, whichever the affected part of the colon is. There are a bunch of different techniques for doing that, everything from laparoscopic and robotic surgery to open and traditional surgery. Beyond that, the other treatments include sometimes chemotherapy, sometimes radiation. It all depends on the particulars.
When we're talking about the surgical procedure, robotic versus laparoscopic, can you kind of give us a brief description of how those are different and when those procedures would be used?
So I think one of the things that explains why Ray and I are on the conversation together this morning is because we're focused on how do we make this this intervention as smooth as possible for the patient, and making sure that our patients are healthy and sturdy, that they're strong enough to tolerate the procedure, that they have the opportunity to recover following the procedure is critical. From a surgical perspective, one of the things that we can do is we can offer what's called minimally invasive surgery, and that, because, just as its name implies, typically is less difficult for patients to tolerate. The standard approach for several years has been laparoscopic colon surgery, but the great advantage of the robot is that it gives the surgeon a lot more flexibility and capability so that we can do more complicated and intricate procedures, sticking with the minimally invasive approach, and patients absolutely benefit from that approach. It's less debilitating and disabling, and therefore the patients recover quicker, they're out of the hospital quicker, they resume their normal life a lot sooner, so that's absolutely beneficial.
All right, I want to bring Ray back into the conversation. Ray Adams, Physical Therapist, Cancer Rehabilitation Specialist. Ray, does the rehabilitation begin post-operation, or does that actually start before you go in for surgery?
Yeah, we'd like to try to get people in as soon as we can. We actually have a term for it. We call it rehabilitation. So actually at the time of diagnosis, if we can get them in to kind of start educating them about what's to come, we can help people, kind of decrease their anxiety and their questions and stuff about what they anticipate. I know the surgeons do a really good job of telling them, hey, this is what we're going to do with the surgery and stuff. But also I think sometimes the more they hear it, the better they can understand it and help them, I guess, cope better with what's to come.
So what is your role, and what can the patients expect post-op as they start to recover from the procedure?
Yeah, the cancer rehab program is kind of designed to help them cope with the side effects of the treatment. And studies have shown that 60 to 90% of all people who go through cancer treatment will have some side effect that could benefit from some kind of rehabilitation intervention. And those side effects that we help deal with can be pain, fatigue, neuropathy, which can also often be caused by the toxins of the chemotherapy drugs, joint stiffness, balance and gait problems, trouble with ADLs, and weakness. And we can help address all those side effects.
I know each patient is an individual, unique. There's no one size fits all, but can you give us a general idea of how you address all the above? I know I'm asking a broad question there, Ray, but give us a general idea.
Yeah, what we do is it all starts with a referral from the surgeon or the oncologist. We try to work closely with them, but what I try to do is individualize every program. They'll come in, we do a total body screening from strength, stamina, endurance, balance, try to focus in on what deficits they might have, and then individualize the program to each person. I have some folks that want to come in 3 times a week because they feel they need a lot more intervention, a lot more direction. Other folks that want to do a self-focused program that they may come in once a week or once every couple of weeks and just do a home program on their own.
It's all about the individual, it sounds like.
Yes, sir, it is. Yeah, we try to individualize it as much as we can so they're in total control of this part of their treatment.
Talking to Dr. Mark Johnson, general surgeon for Mon Health Surgical Care, and Ray Adams, physical therapist and cancer rehabilitation specialist. Dr. Johnson, what role does family history play when it comes to colon cancer?
Probably the most important thing is that if there's a history in the family of colon cancer or colon polyps, it affects our recommendations regarding screening evaluation. Unfortunately, a family history does slightly increase the risk that you might have a colon problem, including a colon polyp or cancer. And so we're more aggressive in terms of when we recommend screening exams and how frequently we recommend them.
When should you start getting that screening completed, and how often should you get it done?
Yeah, so it's an interesting and actually has become a little bit of a controversial question in the management of colon cancer. The standard approach for the longest time was to recommend that when you hit your 50th birthday, as if it's not traumatic enough to turn 50, that we would recommend that you have a screening exam. But now we recognize, unfortunately, that we've seen an increase in the incidence of colon cancer in younger people. So now we recommend that anybody at the age of 45 should have a screening colon examination. And if you have a family history, as we were just referring, maybe even earlier.
Is that a yearly screening you should get done? Are you good for every couple of years? How often?
It depends a little bit. So there are options. The gold standard has always been colonoscopy, but there are other techniques, including stool studies and X-ray tests and things of that nature. And so, depending on exactly what's best for you, what you're comfortable with, what your risk factors are, we can sort of individualize that. For example, if you're going to have a colonoscopy for the average risk patient, that's a examination that's done every, say, 7 to 10 years. With a family history, it's every 5. Some of the other screening mechanisms that we use aren't nearly as sensitive as colonoscopy, although they can be more convenient. And so the trade-off is you'd have to have them done more frequently in exchange for not having to go through a colonoscopy.
Dr. Mark Johnson, general surgeon, Mon Health Surgical Care, and Ray Adams, physical therapist and cancer rehabilitation specialist, joining us here on Mon Health Talk this morning. It is Colon Cancer Awareness Month. Ray, what are some of the frequently asked questions you get from patients about the rehab process and what they may experience?
Usually it's a lot of it's the fear of the unknown. So we try to tell them that, if you undergo chemo, your hair is probably going to fall out, and things like that. But usually they want to know, what can I get back? Can I get my life back, or is this as good as it gets? And sometimes we don't know. Dr. Johnson, I'm certain, gets that question too. And what we try to do is just enable them to get as much of their life back and as much of their freedom back as they can. Kind of our motto is we don't want patients just to survive. We want them to thrive. And so I think our role is just to help them get back as much of their pre-cancer function as they can.
And Dr. Johnson, how much, I guess that is determined by how early you catch the cancer, where it is, what stage it is in, all the above there?
Yeah, absolutely. I think that the key thing is the first point that I made today, and that is we really can do wonderful things. Colon cancer is not a death sentence. It's a manageable problem. Comprehensive care like you can get here in Morgantown. But the most important thing, I think, is participation. I think my advice to all of my patients is, listen, a screening colonoscopy or a screening examination is not the funnest way to spend your day, but it absolutely is the best way to keep yourself out of trouble and to identify a problem in its earliest stages. That gives us the best chance to treat you and help you get through this. And so it's just again, encouraging my patients to seek screening mechanisms is absolutely critical.
And Ray, I think it's important to emphasize that you don't have to attack this by yourself, and it's not just, Dr. Johnson's going to do the surgery, you get sent home, good luck. There is comprehensive support from start to finish with the team at with the team here.
That's what I think you hit the nail on the head there. That they're not in it alone. I mean, we're trying to help them on their cancer journey and enable them as much as we can and try to give them whatever support we can.
And what's the reaction you get from folks when they realize the support mechanisms that are there?
I've had some patients. Unfortunately, it's not a colon cancer. I had a patient the other day that had breast cancer treatment 4 years ago. And her response after about 3 treatments is, "Where were you 4 years ago?" She goes, "Because I'm feeling better already, and it's just been 2 weeks." And so I think that's the thing, that we can just really help them recover and help them get back some normalcy in their lives.
Dr. Johnson, where can we get more information?
Well, the Mon Health website is a great place to start, including referrals to myself and my colleagues. We have a comprehensive cancer care center here at Mon Health, and so a lot of the information is there available at the website.
And, of course, the website is monhealth.com. You can get more information on Dr. Johnson if you go to monhealth.com/general surgery as well. Dr. Mark Johnson, general surgeon, Mon Health Surgical Care, and Ray Adams, physical therapist and cancer rehabilitation specialist. Guys, I appreciate the time this morning. Thanks so much.
Hey, my pleasure.